Welcome, ladies and gentlemen, to sqadia.com. My name is Mohammad Osama, and today we are talking about nutritional disorders. And nutritional disorders, we are going to talk about malnutrition. So, let's look at the contents of this lecture. So, in malnutrition, we are going to talk about what malnutrition is, what are the different types of malnutrition, and we're also going to talk about the common diseases which are actually associated with malnutrition, such as marasmus and kwashiorkor. So let's start off with malnutrition. What is malnutrition? So malnutrition is actually a medical condition that results from eating a diet in which the nutrients are either not enough or they're too much. So contrary to the popular belief, it is not necessary that malnutrition only results from the lack of nutrients. Malnutrition is equally a result of when there are more than enough nutrients, such as in case of hypervitaminosis or obesity, in which there is too much of specific type of nutrient. So malnutrition can either be because of lack of nutrients or too much of any of that nutrients, which actually results in different kind of health problems. So if any type of nutrient, either its excess or either its deficiency, is resulting in any type of health problem or issue, then that is known as malnutrition. Now, malnutrition may involve calories, proteins, carbohydrates, vitamins, minerals, fats, or any other type of dietary component. Now, malnutrition also has a very great effect on healthcare system because malnutrition can result in different type of conditions, and in different type of conditions, malnutrition can actually increase the severity of that condition, resulting in increased morbidity. Similarly, malnutrition may also result or contribute in impaired wound healing or poor wound healing process. Moreover, malnutrition can also result in increased chances of infection because of decreased immunity, such as due to deficiency of different type of vitamins. Moreover, malnutrition can also result in different type of complication associated with pre-existing diseases in a person. And moreover, the malnutrition can thus result in increased mortality, which is the death rate, increased duration or increased quantity of treatment required, and as well as increased length of hospital stay. So all of these components and all of these factors when combined result in increased cost of management as well as decreased quality of life. Now, how is malnutrition present and how is malnutrition found in affluent or developed countries? So malnutrition is not just a problem of the developing or the underdeveloped world. It is also equally found in the affluent and developed countries, such as in the United States. It is said to have an obesity which is very common, and it is a type or it is a result of malnutrition. So in affluent countries or in developed countries, malnutrition is found in those children who are actually living below the poverty line. Because of the poverty, they do not get the required nutrition, or even if they are getting the nutrition, they are not getting proper nutrition, like their diet may not have the exact amount of vitamins and protein and other essential things which are required. Similarly, in elderly, there can be malnutrition if they are not receiving proper diet, even though if they are not poor. Similarly, alcoholics, because malnutrition is also associated with alcohol. Contrary to the popular belief, we believe that it is not associated, but it is. And especially people in developed countries who are on different type of diet programs, which are sometimes doing more harm than good to them, they can also result in malnutrition, as well as eating disorders like anorexia nervosa and bulimia nervosa and other wasting diseases as well. So let's look at these one by one. So we talked about people who are on different type of diets which are doing more harm than good. One example is a fad diet in which there is actually a promise or a hope of quick weight loss, and everybody wants to do that who is uh, actually subjected to obesity. So they want a quick solution, so they follow a fad diet, which is actually doing more harm than good. What actually happens is that because this type of diet is unhealthy and unbalanced, so even though that it is claiming that a person loses fat because of this diet, what the person is actually losing is just water, and that actually results in a minimum amount of weight loss. But as well, as soon as that water part in the body is recovered, so that weight loss is also not visible anymore. Secondarily, it also results in malnutrition because that person was deprived of many essential vitamins, many essential nutrients like proteins and other stuff, which would lead to different type of diseases. Now, one another very common malnutrition related disease or malnutrition related issue in developed countries is anorexia nervosa, which is most commonly found in young females. So, anorexia nervosa is an eating disorder which is characterized by abnormally low body weight, and still, even in the presence of a low body weight, the person has an intense fear of gaining weight, which results in abnormal diet or deficient diet, and the person has a distorted perception of weight. So if you look at this figure here, we can see that what are actually the manifestations of anorexia nervosa. So one is the brain. What happens there is that the person cannot think right. The person has a fear or phobia of weight gain, which is not healthy for the brain functioning, and that results in altered mood, in depression, and the person becomes irritable as well. Moreover, because of poor diet, the person has bad memory, and because of either hypoglycemia or any other condition like that, either hypoglycemia or hypertension, the person can faint as well. The person, because of poor diet, also possesses or also shows signs of anemia. There is also intestinal bloating and constipation because of poor diet, and there is also symptoms are also found in the musculoskeletal system in the form of weakness in the muscles or atrophy in the muscles because of decreased protein intake, and inflammation and swelling in the joints. And because of poor diet and poor calcium intake, there is increased risk of fractures and osteoporosis. Moreover, there is low potassium, low magnesium, and low sodium. Moreover, hairs become thin and brittle. There is low blood pressure, which, or you can say hypertension, and there is slower heart rate, which is also known as bradycardia, and there are palpitations in that individual, which means that a person becomes aware of his or her own heartbeat. Kidneys can also move on to failure because of the poor nutrition, and kidney stones or renal calculi can also be found. In the skin integrity is also altered, and the skin can bruise easily, and the skin is also dry, and there is growth of very fine hair all over the body, and the skin becomes yellow in color because of anemia, and nails also get brittle. And moreover, there is hormonal imbalances as well because of imbalance in the diet, which may result in bone loss and problems during the growth period of an individual. In women, there can also be different type of issues related to their menstrual cycle, and can also even result in amenorrhea or maybe dysmenorrhea, and they also have problem in getting pregnant, and there is also a problems of infertility. And even if a person gets pregnant and the person is suffering from anorexia nervosa, so thus there is actually malnutrition. So what happens is that there is a higher risk of miscarriage, and There is low birth weight of the baby, which can be dangerous for the baby because baby is also not getting the proper nutrition because the mother is malnourished. And similarly, because as you can see that weight gain is more or less weight gain is associated with pregnancy, then these women would result in actually depression, which would be associated with their pregnancy as well, because they would perceive that we are gaining weight. And C-section is also commonly observed in women with anorexia nervosa. Moreover, there is a chronic wasting disease, which is a transmissible spongiform encephalopathy of the brain and the central nervous system, and which brings us to a very important part, which is the alcohol-related malnutrition. So, how does alcohol-related malnutrition occur? So, alcohol is actually, it has calories, it has energy content because there are 17 calories per gram of alcohol, but it has no nutrients, it has no vitamins, it has no protein or whatsoever. So it is just like pure sugar without any nutrition. So when a person consumes alcohol, so the person is getting calories, so but the person is not getting any nutrition. So that may be associated with less food consumption because the person got calories from the alcohol already. So but that calories or those calories were nutritionally deficient. So that also leads to malnutrition. And even to make matters worse, alcohol also interferes with the body's own metabolism of nutrients, leading to liver damage and damage to the digestive system, and in fact, damage to nearly every bodily organ. So let's take a look at this diagram here, and this actually summarizes the effects of alcohol in terms of malnutrition. What happens is that if we look at alcohol, we know that alcohol has direct impact on the whole body, and especially the digestive system as well as the liver, as we see that excessive alcohol use is associated with liver cirrhosis as well. So direct toxicity is there because of the use of alcohol, but in addition to that, alcohol gives us empty calories without any nutritional benefit, so that results in malnutrition, and that malnutrition can then further lead to functional impairment, both in terms of liver function and GIT, which is the gastrointestinal tract, stomach, and intestine, and all of that. So that is the effect of alcohol on malnutrition as well. Now, the two most common conditions associated with malnutrition, especially in the developing or the underdeveloped countries, is marasmus and kwashiorkor. So these are both the diseases of children. And if we talk about marasmus, it is also known as the disease of the displaced child, because it occurs in children which are less than 1 year of age, and in which they had another sibling, or the mother got pregnant and had another baby. So what happened is that they are actually deprived of breastfeeding, and there is not any adequate source of nutrition or proper nutrition for those children. So they are actually caused by a widespread deficiency of almost all nutrients, including both calories and protein. So calories from carbohydrates and protein. So that baby or that child is having deficiency of both. And it is also associated, or it coexists with vitamin deficiencies as well, because that child had the only source of nutrition for that child was his or her mother. And because of another sibling, that child has been displaced or removed from breastfeeding. So what are the clinical characteristics? So it is characterized by retarded growth, loss of muscle and other protein containing tissues because there is no protein intake, and as well as loss of subcutaneous fat because once again there is no calorie intake or carbohydrate intake as well. But the child may have normal hair, but the child would have an appearance like an old man or wise in appearance, and there would be thin limbs with little muscle or little fat because of deficiency of both protein and carbohydrates, and the child would be very much underweight. On the other hand, if you look at kwashiorkor, it is also a disease of the children which have been removed from breastfeeding as well, maybe, but they are greater of 1 year of age, so they are no longer breastfed, and they're receiving a diet, but that diet is rich in carbohydrates and starchy food but deficient in protein. So they are receiving food but they are malnourished still. So that is kwashiorkor, and it is different from marasmus, because in marasmus we observed that there was a deficiency of both carbohydrate and protein. So it is caused by protein deficiency only with adequate calorie intake, and it is also clinically characterized by retarded growth, muscle wasting, but there is subcutaneous fat. So they would not look as lean as those children with marasmus. So if you look at the clinical presentation, where there would be swelling of legs and edema, there would be sparse hair and moon face appearance with little interest in surroundings, flaky appearance of skin, swollen abdomen in these children, and thin muscles, but fat is present, so limbs may not look very thin and skinny. So if you want to distinguish the abnormalities associated with kwashiorkor from marasmus, so in kwashiorkor there would be a fatty liver, there would be severe edema, and there would be edema which is because of protein deficiency and decreased oncotic pressure, but still there would be adequate amount of fat, and there would be anemia because of, once again, protein deficiency, malabsorption due to atrophy of the small intestinal villi, and depigmented bands with pale streaking in hair and skin. So that was all about malnutrition, in which we talked about malnutrition and malnutrition in developed as well as underdeveloped countries, and marasmus and kwashiorkor with its association with malnutrition. So stay tuned to sqadia.com for more lectures like this, and thank you very much.